Thank you very much for this kind introduction. It's a great pleasure to be able to share this day with you. Let's see if I can bring up my slides. Oh, sorry. Okay, so I'm going to speak a little bit about international priorities for cancer prevention, and particularly try to put in context some of the international efforts that are needed to fight this disease. And if I'm stood here today, it's really because of another president of the Republic, General de Gaulle, some years ago, who supported the idea of French scientists and clinicians to create an international agency for research on cancer, to try and fight cancer on a global scale. And that vision was really important in establishing IARC, and the idea was to join together forces to fight this disease worldwide. And it's been a great pleasure as the director of IARC to see the support that we've had actually from the French Cancer Institute and many colleagues in Lyon and elsewhere in France in our work on a global scale. And we recently published, in fact, yesterday, the World Cancer Report 2014, which tries to make a summary of the current situation for cancer control on a global scale. When I talk about cancer prevention, I just want to be clear what I think the scope of that activity comprises. First of all, we need to describe the occurrence. And for many parts of the world, we still don't have adequate information about what types of cancer are occurring. And without this information, it's very difficult to have an informed approach to cancer control. We then need to establish the causes of cancer. This is the first step to prevention. We need to evaluate ways to prevent the disease and formally demonstrate their success or otherwise. And then, very importantly, we need to conduct research that supports the integration of these prevention strategies into the healthcare services in different countries. And this together gives us a collective approach to cancer prevention. So I'm just very quickly in this presentation going to do three things. Describe a bit the scale of the problem globally, talk about implementing what we do know, and perhaps just mention at the end some things that we need to address where we have gaps in our knowledge. So these are the latest figures that we have on the global burden of cancer. 8.2 million people dying in 2012 from the disease, 14.1 million people developing cancer. And I want to draw attention to the bottom part of this slide, 32.5 million people worldwide living within 5 years of a cancer diagnosis. And it's clearly insufficient for governments simply to be aware of the number of new cases or the deaths from cancer, but also to provide services and care for those individuals that have had the experience of cancer. This type of information is vital. And throughout the rest of my talk, I just want to add a caveat that it's quite a risk, I think, when we look at these global numbers to forget the effect cancer has at the individual level in families, and that experience is really uniform across the world, and I can give some testimony to that from my own experience. If we look even by Human Development Index at the projections of what will happen to the numbers of cancers worldwide in the coming years, I put this slide together looking from the lowest to the highest levels of human development. And you can see that in just a 12, 13-year period, the sort of increases in cancer burden that we're likely to see. And this is based only on the changes in the population, the growth of the population and the aging. And if you translate that into a percentage increase, you see that actually the burden is increasingly falling on the low and middle-income countries. And these, of course, are the countries that are least able to cope with this increasing burden. But we should say that in all countries, in fact, the spiraling costs of cancer, treatment and care are putting a huge burden on the economies. So my first conclusion from these figures on a global scale is that we cannot treat our way out of the cancer problem. We need a more balanced and integrated approach to prevention and treatment in order to tackle this challenge. So this is not an either-or. It's a plea, really, for an integrated approach in both these areas. Cancer is a global problem, but it's not a uniform problem. I just put one slide up to illustrate that. This is a maps showing the most common cancer in men and in women in each country worldwide. I think you can see the predominance of the effect of tobacco, for example, on lung cancer, many parts of Eastern Europe, Southeast Asia, Eastern Asia, some of the most populous countries in the world affected by tobacco-related cancers, lung cancer in this case. And perhaps to draw your attention to the bottom slide and just the overwhelming dominance of breast cancer as the most common cancer among women in most parts of the world. Notable exceptions being sub-Saharan Africa and parts of Latin America and Southeast Asia, where cervical cancer, an eminently preventable cancer, is still the most common amongst women. And to put this into some context, 25% of all cancers among women worldwide are breast cancers, and 20% of all cancer survivors are breast cancer survivors. The picture of cancer is not static. As countries undergo economic development, we see changes in the types of cancers which occur. And I just put this up by way of illustration, showing the divergence in incidence of breast cancer and cervical cancer with changes in human development. You can see in countries like Australia, where this divergence occurred many years ago, and other countries like Colombia, where this is now happening. So governments need to be aware not only of the pattern of today, but the projections forward in the next decades. What can we do to address this problem? I think if we could implement the knowledge we currently have about the causes of cancer, we could prevent something around a half of all cancers. And this, of course, varies depending on the country, the profile of the risk factors. But we also know that the majority of cancers have a lifestyle or environmental component. And therefore, the potential for prevention, if we could identify those factors, is still greater. Not to dwell on this slide, because not the purpose of this introduction, but there's been tremendous progress made over the last 4 or 5 decades in terms of understanding the causes of cancer. And in this, tobacco, of course, stands as still the single biggest challenge on a global scale for cancer control. But also perhaps less well known is the fact that 1 in 6 cancers worldwide, some 16%, are associated with a chronic infection. And increasingly, the epidemic of obesity and physical inactivity is taking its toll and adding to the cancer burden, not only in the high-income countries, but increasingly across the world. I think it's worthwhile making a clear point about prevention working. I mean, we have the evidence that if we intervene, we can reduce these cancer projections. This slide just shows 2 examples. The first one, lung cancer among men. You can see these dramatic decreases in the incidence of lung cancer in the US, in the UK, in countries like Finland, in Scandinavia. And this is the result of reducing tobacco consumption. This takes time, but it works. On the other side of the panel, you have another cancer, cervical cancer. And perhaps just draw your attention to the situation in Finland and the very low rates of cervical cancer among women in Finland. If I showed you the data for Finland going back 40 or 50 years, you would see that Finnish women had roughly the same cervical cancer rates as parts of sub-Saharan Africa today. What's made the difference is the introduction of an effective screening program for the detection of precancerous lesions of the cervix. And some of these methodologies are highly applicable to the developing world. So prevention works, but prevention also takes time, and that's why it needs a political commitment and a vision from the leadership in order to combat cancer in the long term. Here's an example of a challenge that we now face with the availability of a vaccine, an effective vaccine against human papillomavirus, the major cause of cervical cancer globally. Without going into the detail on this slide, these are some modeling of the time it would take to see the impact of the vaccine on cancer rates in different populations. And you can see that the introduction of the vaccine will start to have its effect in 2 to 3 decades. But here we have an effective prevention tool. It just needs the commitment to introduce this vaccine, and particularly to make it available in the countries where cervical cancer is most common in the developing world. So we have not only the primary prevention, but also the possibility for the early detection and treatment of cancer. And I've just listed here some of the cancers for which that approach can be effective. Breast cancer in particular. So just finally addressing some of the things that we don't know. I've put on this slide some cancers which are common across the world, but for which the causation is still largely unknown. One could argue about some of these and the proportion of those cancers for which we have risk factors identified. But in general, these are major cancers for which we still don't have strong identified risk factors. And I think this is where we can see the benefits of the basic science, the remarkable progress in understanding how a cancer develops at the cellular and molecular level. I mean, this has been absolutely striking in the last 2 decades. And this understanding is finding its natural translation into the clinic to tailor treatments more specifically to the tumor under treatment. And really, France, I have to say, has been one of the leaders in taking this knowledge into the clinical setting. But I would like to argue as well that we can get a double benefit from these advances in the basic science, and that now the tumor itself can reveal to us some of the secrets of its own origins. So we need to take this understanding of the science and the molecular technologies that we have, which can be applied to populations to help us understand the causes of the disease and to detect it earlier, and therefore lead to prevention. And I restricted myself to one complicated slide this morning, but I wanted to show you this slide. This is a study of renal cell cancer, the most common form of kidney cancer, for which we know relatively little about the causes. And in this study, the investigators looked at the type of molecular change in the tumor of the same type of cancer, but in 4 different populations. And without going into detail, just to explain that the color on that graph is representing different types of molecular change in the tumor. And I think you can see very clearly that the Romanian kidney cancers differ strikingly from the other populations. And in fact, that signature, that fingerprint, if you like, in the tumor is something that we've seen elsewhere in Romania, in that region, with a different type of cancer in the upper urinary tract urothelial cell tumors. So what this molecular analysis is suggesting to us is that the same risk factor may be involved in those 2 types of cancer in this population. And it happens to be a naturally occurring carcinogen, aristolochic acid, which can be a contaminant of the diet. So I put this slide up not really to dwell on the specifics, but just to illustrate how analyzing the cancer can actually start to give us clues to the causation of the disease and drive us back into the population to do more epidemiological studies. And I think this benefit, this interdisciplinary approach, offers much in the way of the future of cancer control. So I like very much this quotation from the Kalenjin tribe in Kenya. This is the tribe that have produced the vast majority of the great middle distance runners. And they have a phrase which says, we should put out the fire while it is still small. And I take this as a good idiom for cancer prevention. And I'd like to emphasize as my final point at the bottom of this slide, this integration again, that we have most certainly a duty of care to the cancer patients of today in terms of the treatment and the care around the experience of suffering from a cancer. But we also have a duty of care to the populations of tomorrow. And in this case, we need to focus on prevention and the commitment at all levels to that goal to provide an overall response to the challenges of those cancer projections I presented earlier. Thank you very much.